So June is Men's Mental Health Month, and today we're going to focus on a group that is often sidelined in mental health conversations, Black men.
And that's because data shows increasing rates of discrimination, anxiety, and depression impacting their mental well-being. Added to this are cultural expectations of toughness and a lack of trusted mental health support. Dr. Michael Walker here to share why emotional care is essential for Black men and how we can support them meaningfully. Such an important conversation, especially in this day and age.
Yeah, no doubt. It's definitely an important conversation. As you said in the beginning, really we had to think about the issues of why that is focusing on Black men, right? Even when you have folks who are academically high and making a nice salary, they still report higher stress levels, higher anxiety levels than other groups.
One of the things we just mentioned in the intro there was these barriers to mental health care. Can you talk about those?
Yeah, there's a couple, right? So I'll go starting with the mistrust, right? So there's mistrust in the mental health profession or just the medical profession as a whole. And some of that is based in historical context, and we may not be sometimes aware that it's based in that. You think about the Tuskegee Project that happened. You think about the J. Marion Sims experiment that was going on with our enslaved women, and they were doing all those surgeries on them without anesthesia and those sorts of things. So those things are passed down from generation to generation. And so you'll hear statements of our elders saying, yeah, I don't really trust the medical profession. And so that builds into me as a young person. I hear that, so now I start to believe that. Then we start to think about really about who's in the workforce, right? So when we look at our mental health professions, there's about 4% of our mental health professionals who are Black, right, in the psychology world. And then about another 7% who are family counseling and marriage counselors. So you start to see that there's not many numbers in that, and that creates some of the distrust.
I'll tell you this too, from personal experience here, when you are looking for a Black doctor in the Twin Cities, it's hard to find.
For sure.
When you're looking for a mental health professional in the Twin Cities that is a person of color, they're hard to find. So when you have those smaller numbers, you don't necessarily feel that you have someone you can necessarily relate to or someone who is going to understand your experience.
Correct, and that creates some more distrust, right? And so I feel not seen, I feel not heard, I don't feel valued, and I'm just not willing to open up as much or be vulnerable, right? So that is a barrier.
Can you give us some practical support strategies?
Yes, I know you all had Dr. Yeager on the
show
today, and so shout out to Dr. Yeager, but I'm going to talk about his study that he did. He did a randomized controlled trial, which is the gold standard in scientific research. And what it really was based on is really like the CPR model, right? So you know how we equip people with CPR to be able to support those in times of need, right? Not that they're taking over the place of medical professionals, but to help in case when they, so when the medical professionals come, they have done something to do that. Well, he did a trial around how do we do that for mental health support for communities. So how do we equip regular everyday people with strategies to be able to support individuals as a first response to someone maybe having a mental health crisis? And so his study was obviously did well, and so there actually is a group called the Confess Project. Have you guys heard of the Confess Project?
No.
So it's an organization that is really centering on how do we equip people with this like CPR model around mental health. And so they are really tackling barbershops and hair salons and working with barbers to give them those tools and strategies as a first response, because that's a safe space specifically for Black men to have conversations, and now they can listen and be aware and then can point them into the right direction of where they can go to get additional services.
What are some of the things they're sharing with them?
Yeah, well, obviously some of the things they're talking about is the stress and anxiety, right, of just being a Black man in today's society, right? There's all the microaggressions, there's the distrust, there's racism that is happening, and then with that, I'm also have to wear this toughness as a Black man. Like, it's hard to be vulnerable. I did a segment months ago around vulnerability, and when you think about that connected to Black men, it's even harder to be vulnerable because sometimes it's used against you later on. And so we have these, definitions.
The double-edged sword.
For sure. For sure.
It's a conversation that will continue to happen, and we have to have you back on so we can continue this. Again, continuing the conversations, but we appreciate you joining us this morning.
Thanks for having me. I appreciate it.